Today, we're talking about knee pain, but not just any knee pain. We're talking about knee pain under a specific condition. This is all coming from Pete Egoscue's book, Pain-Free, the Revised and Updated 2nd edition. And we're talking about the menu on page 112 here for, what's this condition? It's if you have internally rotated femurs. Now, how do you know if you have internally rotated femurs? Well, you can tell if your femurs are rotated internally by just taking a look in the mirror and standing with your feet how they normally fall. Now, if you notice that your kneecaps are pointing in towards each other, that means that your femurs are internally rotated. Your femurs are the big bones that connect your hips and your knees. So the knees have to kind of follow with what the hips are doing. And also, you'll often find that the feet are following that as well. If you have an internally rotated femur, you will often have a foot or be walking pigeon-toed or standing pigeon-toed, meaning that both your feet are angled in like this, one or both of your feet. That's how you can tell if you've got internally rotated femurs. And if you do, this knee pain menu might be just what, well, not the doctor ordered, but, someone. So, what Ecises are contained in this menu for internally rotated femurs and knee pain? Well, first we have standing at wall with block. Then we've got wall stork, cats and dogs, lying supine, or I usually call it lying supine with block, modified floor block, cats and dogs, and finally air bench. So what the heck are the exercises in this book going to do for you? Well, obviously, we're going to try to be bringing those femurs out to a neutral position. Not rotated in, not rotated out. The first exercise in this sequence is called standing wall with block. So we have all of our load-bearing joints in alignment using the wall to enforce that. And we are using that block or pillow or cushion, whatever is between your knees there, to strengthen your adductors and allow the glutes and the abductors to start doing their job, getting them to release and to bring those femurs to an even rotation. Even if it doesn't get them fully neutral, we're trying to at least, if one's pointed if one is pointed in more than the other, we're trying to get them to point to the same degree in. Once they're pointed to the same degree in, we'll start bringing them to a neutral position. The next exercise in this sequence is called wall stork. Now, wall stork is a exercise that is great for not only stretching out your hip flexors and under load, because you're actually standing up, unlike a supine groin stretch where we're laying down and there's no gravitational load on those hip flexors. In this case, we are strengthening the hip flexors while stretching them out or elongating them. And this really helps to make sure that your upper body can work independently of those hip flexors, meaning that the hip flexors are no longer compensating for dysfunctions in the upper body. And that's going to be a key thing to getting your knees back to a neutral position. I think most people are familiar with the exercise cats and dogs from yoga, or depending on where you're from, you might be called cat-cows. But this exercise and how we're using it here is meant to kind of propagate the changes that we've just made in the adductors and the hip flexors up throughout the spine. That sinusoidal motion is very important here, because it propagates those changes just like a wave from the hips all the way up to the head. The next exercise in this sequence is lying supine or lying supine with block. Now, this exercise looks very simple, but I can assure you it is anything but. You're going to find that a couple minutes into this exercise, you're going to feel muscles waking up in all parts of your hips and maybe your abdomen, your lower back, your thighs. There's just so much going on here, because we are preparing the body to be vertical by kind of tricking it into that standing position, but while we're laying down, and we're putting an unusual load when we're squeezing that block with our ankles or with our feet. You're going to be very surprised when you try this exercise. It's going to wake up the whole kinetic chain from your ankles all the way to your head, and it reinforces that load-bearing joints being one plane rather than slumped and forward. We're getting that head back, and we are getting the knees to work in conjunction with the ankles and hips. Next, we have modified floor block. Modified floor block is a great way to, we were just lying on our back. Now we're going to do the same thing lying on our belly. We're going to get all those joints into a load-bearing position, stretching out the chest. We're getting both of the leg femurs into a neutral, the same rotation of in the internal direction. So we're getting rid of those asymmetries from one side of the body to the other. It's going to be the real point of modified floor blocks in this case. Now we have cats and dogs again. We're once again propagating the changes that we've made in the hips between lying supine and modified floor block all the way up throughout the kinetic chain, using that sinusoidal wave motion again. And it just helps to propagate and equalize the spine and let it get used to the new position in the hips and the pelvis. And finally, the last exercise in this menu is air bench. Air bench is a great way to strengthen the lower body muscles, the big movers, the big gait muscles, while we are keeping the upper body in a neutral position, all of the load-bearing joints in one single plane. We're not strengthening the lower body. When you're doing squats and things like that, we're hunched forward, right? No. We want to be strengthening the upper body or the lower body while the upper body is forced into perfect posture. This is going to get rid of rotations and compensations in the lower body while we're strengthening those hips and those thighs and the calves, the ankles, and making sure that we are reinforcing all those postural changes we just made throughout all those other exercises and trying to get those knees back to a more neutral position. Once again, that is a common theme throughout this menu.